Good evening to everyone, and welcome to the Pulse of Practice webinar series, the Student Edition. My name is Sophie Shilobana, and I will be your host this evening. I am currently in my sixth rotation at Tele Mokgorane Hospital under surgery, and I can see that graduation is much closer than anticipated, but it's been a journey. My interests personally lie in emergency medicine, but I do also aspire to one day find myself in the corporate medical space. A warm welcome to all our guests. Today we have students and clinical associates from Wits University, from the University of Pretoria, and Walter Sisulu University. We are on our sixth webinar this year. These webinars are held each Monday on the first Monday of each month. The aim of these sessions are for three things: to empower students to be aware of the diversity of clinical associates in the workplace, to have the questions answered, as well as to link students through the community. Personally, I've had a lot of beneficial questions answered during these webinars. One of them that I remember is when we had Megan, who is working with an anesthetist, and I didn't know that straight after graduation, you can find yourself in a space where you are actually more like specializing and choose exactly which department you'd like to work in. And also, I had never known that you can also be in a space where you're in a corporate world working as a clinical associate, which, like I said, is one of my biggest aspirations. Today, we welcome three guests. Each speaker will speak for 10 to 15 minutes. Without wasting any time, let's start. Our first speaker for today is Kelly De Silva. Kelly De Silva is a clinical associate who graduated from the University of Witwatersrand in 2016. Following graduation, Kelly had experience being a clinical associate lecturer in the Division of Clinical Associates. Afterwards, she continued her education and research and became a certified clinical research associate and started her career as a research associate, continuing as a study coordinator at Wits Vida Research Unit for 4 years. Currently, she is a senior site activation specialist for the United States of America and Canada site at IQVIA CRO for 2 years. May we please welcome Kelly.
Thank you so much for the wonderful introduction, and it's lovely to see so many of you on this call. I'm Kelly De Silva, graduate of 2016, and I'm very grateful to be part of this great organization that you guys have made. We didn't have this when we were studying, so it's really nice to see that this is happening. I'm the guest speaker of today, one of them, and let me get started so I don't waste your guys' time. So I'm going to introduce myself. I'm going to give you guys the roles of clinical associate in my workplace, past and present, personal achievements, challenges, experiences that I had to overcome, as well as an encouraging message. A little bit about me. I am 29 years old. I graduated from BCMP in 2016. Personally, I have a wonderful boyfriend and two fur babies called Maya and Milo. Professionally, I have over 6 years of clinical research experience, and I've been very lucky enough to have quite a vast working experience within the research industry. My previous roles were associate lecturer at Wits. I worked alongside Aviware and Valentine, and as well as being 4 years within a lead study coordinator position at Wits Vida. So that is one of the largest research institutions in Chris Hani Baragwanath. And those who've worked at Barra, you guys have probably seen Wits Vida staff members walking around and doing research within that site, as well as Linian Goy and Bekim Langeni. So that's our main point of research. My current role is I'm a senior site activation specialist at IQVIA. So that's a CRO. And what a CRO does is we work with sponsors like Pfizer and JSK, Janssen and Janssen, and we actually get them sites that will be perfect for their research. And we then go through that part and we vet them, read site outreach with them. We go through all the processing of collecting all their documents, and we basically get them activated as soon as possible. And I'm a senior within that position, and I'm working with mostly US, Canada, and Puerto Rico sites. And I get them activated for all the largest CROs that, for our CRO, that is the largest sponsors that we can get. And then I'll just then give you guys a little bit of an update on my experience and what it's like being a clinical associate. So when I started out in the research industry, there was very little known about what a clinical associate is, what we're capable of doing, and what we studied. It was extremely difficult for me to actually break the barrier as how do I inform people what I do and show them my capabilities, and also go beyond the clinical aspect where clinical associates are seen as all we could work is within the hospital or clinic base and not really out there as much. And it was quite difficult to branch out of that. And that is where I was very grateful for the immense amount of work that we were able to do as students. We are hardly in the classroom. We are mostly in the clinics, and we are mostly getting our experience on the ground. And that gave me a lot of grit and resilience. And you need that when you go into the working industry. It's very tough. Um, and you're going to have to prove yourself constantly. But because of that, we face constant obstacles throughout our times in the wards. So this is allowing us to be major out of box thinking, which is very, very valuable. It's a key skill that you need within research because it's always difficult. Every day is a new day and you don't know what you're going to get. So you have to be always on top of things. We have immense amount of clinical knowledge, as well as, we know which clinics are the best. We know which hospitals are the best. And this helps a lot within the health industry to make sure that you meet the timelines and also see if it's feasible for the sponsor to do what they need to do within the timelines they've given you. We contribute a lot within our clinical teams. We are constantly working with nurses, working with doctors, working with fellow clinical associates, and we need to learn how to do that. And through that, you have to learn teamwork and hard work. And that is what we are really good at. Clinical experience also helps us be able to design research protocols and align them with clinical practice. A lot of times there are less clinical experience individuals that are making up the protocols, and it doesn't always translate very well into the actual clinical setting. So we're able to tell them a realistic approach to that. And also we have a very good ethical background in which we have to always do the best for the patient. And that helps us a lot within the corporate side of things, where we make sure that the credibility of our projects are going to minimize the risks for our patients. And that's mostly important within the research industry. Personal achievements in my workspace, my past experience, I was the youngest study coordinator at Vitsvita to conduct the largest infant vaccine trial that the research unit has ever had since 1995. I had a very, very demanding timeline. I had to do it post-COVID, which was an extremely difficult time. I also did research in COVID. I was in the COVID wards. I had to do 23,000 patient data, vaccinations, obtaining sampling and all of that with my team. So I was, in the wards doing it with my team. And then I had to do this infant trial within 6 months and get the basically 400 infant patients enrolled into the study. And it was an extremely difficult thing because if anyone knows how pedantic the postnatal department is in Barra, you know that the nurses there are always on point when it gives BCG vaccinations. And I had to prevent them from getting BCG vaccinations in order for them to be eligible for my study. So that was a feat on its own. So I was able to do that. I was able to get that done. And I got an award for that, for being able to get that through for my sponsor. Through that, I got a lot of research experience. And from there, I went and applied to IQVIA, which is one of the largest CRO companies in the world. And luckily and fortunate enough, they do have positions in South Africa. And I was able to get one as a senior site activation specialist. I've now been part of majority of the largest studies that they have at CRO at our IQVIA center. And my greatest one is the largest Janssen study that I'm currently on for ACS. And I'm the top site activator thus far in 2024. It was a lot of work, but it just shows that we have the capability of doing it as clinical associates. Challenges that I've experienced and overcome. There's so many of them that it was hard to just put a few on the slide. But the most majority that I could think of is stereotyping within the medical industry and the schooling system. I was told that I wouldn't get into varsity because I did maths lit. Definitely would not ever get into a medical industry. And here I am. So you can never let anyone stop you or dictate what you could do or let your past dictate. I was brought up in a single parent house. So my mom was a teacher. We always had a lot of financial strains and difficulties. And I got through my schooling and my varsity career through grants and through a lot of, things that I needed to do to get through it. And that shows me that you can overcome that no matter what happens. Just keep doing what you need to do. Believe in yourself and you can do it. I think also a lack of knowledge within the clinical associates is a lot of barriers that get put down with us because a lot of people do not know what we are, what we can do. But I think and I'm hoping that it's better now since there's so many graduates out there. But you need to be willing to have a discussion with everyone that you talk to, be willing to demonstrate the capabilities that you have, and always walk the talk. I know that they say walk the walk, but walk the talk, because if you're going to say something that you can do it to your best of abilities. Ageism. Ageism I get a lot, especially in every workplace that I've worked in. People think that because I'm so young, I won't be able to be doing things that my colleagues that are in their 40s are doing. It's just a stereotype that you need to beat and just show that you are capable no matter how young you are. And that's just what I keep showing and what I keep proving. If you're unable to break barriers such as promotions, we get a lot of glass ceiling within clinical associates as well as any kind of corporate job. You can hit a snag. Always look beyond your current role, apply to positions that you never thought you could get, and you might surprise yourself. That's what I've been doing, and I've been so far very lucky. And from my current position, I have another position that I'm going to next month, and I'm going to be a site activation manager, which is basically my manager. I'm going to be in that position at ICON, which is the second largest CRO in the world, and I'll be working with basically the whole of Europe. So there's never a ceiling that you shouldn't break. Always try to see what you can do, even if it surprises you. And my keynotes, and I hope that I didn't talk over my 10 minutes, is that always know that your past and present difficulties is not going to make your future duller, but it's actually going to make your future much brighter. always keep learning, always humble yourself, always be able to say, I don't mind being the one who constantly asks the questions in the room, but always know that you're going to benefit from it. Show people how skillful you are, be hardworking, it's never in vain. You will always be successful in your future, and always know that there is opportunities out there as clinical associates. Just keep breaking the wall. And of all else, I wish you all a boundless, successful, and fulfilling future. And remember, education is always key. So keep learning. Thank you, everybody.
Thank you so much, Kelly. Please do remember to stay on um, the calls that we can answer the questions at the end. Thank you so much for the enlightening presentation. Up next, we have Thabiso Libutse, who is also a clinical associate graduate from 2020 from the University of Pretoria. He worked at the University of Pretoria under a few projects for 2 years, namely the COVID-19 We Care project in 2021, the community orientated primary care, and COVID-19 mitigation project in 2022. In that time, he also did a VMMC and GP locums during weekdays and holidays. He was then hired as a PPO serve in January 2024. In 2021, he did COVID-19 vaccination certificates, he obtained a VMMC certificate, BLS, and global package in public health. In 2022, he was working at a GCP, infection prevention and control, and NIMART. In 2024, he then did telemedicine for healthcare professionals with on ongoing with sexual and reproductive health rights, and recently enrolled in a short course for project management. Thabiso is also looking to pursue further studies in public health. Let's welcome Thabiso onto the floor.
Good evening once again. I am very honored to be part of the webinar. Brief introduction about myself. Like I've said, my name is Thabiso. I graduated in 2020 at the University of Pretoria, and I've had about 4 years working experience, and my experience entails private primary healthcare, specifically general practice, circumcisions, COVID-19 vaccination and management, and I'm currently working as a care coordinator at PPO Self. A brief introduction about the company, so it's easier for us to understand the role of a clinical associate in the company. So I'll just go briefly about what the company is and how it functions. It's a health management company established in 2015 by Dr. Brian Ruff. The mission is to make a healthcare affordable using value-based healthcare models through a multidisciplinary team approach. And you may wonder how this differs from, the norm or what we're used to. So at PPLServe, we, offer global fees as opposed to fee for service, and promote multidisciplinary teams as opposed to doctors working alone. And the focus is based on outcomes for patients as opposed to high numbers or volumes. And this is the patient outcomes are achieved through, risk segmentation. So risk segmentation, just to briefly explain, is an understanding who, the patients within each segment has the highest risk of developing significant health event or deterioration. And then what is, value-based care? So the value is measured by outcomes and experience of, the patient divided by the cost. So it's basically a framework for restructuring healthcare by focusing on achieving the best outcomes at the lowest cost. So then if you look at the model, you see that the part of the team, we have the practice transformation coach, and then you have the support team where the care coordinators and allied professionals are, which I am a care coordinator, part of that team, and then they all form the multidisciplinary team supporting the GP practice and the patients. And then also going into more detail about the approach of how the holistic care for a patient is achieved. It starts at internal integration, where the team, the PPOSF team, and the MDT partners, share relevant information, to increase patient care and good outcomes. And then, as we previously spoke, or I previously mentioned, that there's a risk segmentation. So that's when we come to the vertical integration, where it's meant for triage, referral, and collaboration. So once patients are now, stratified, they're classified according to their risk, then they are referred to, their relevant allied healthcare professionals or family medicine practices or hospital. And as we know that, patient problems are not only clinical or medical, we also have social determinants of health. That is when now we come to the horizontal integration of patient care, where we connect patients to services that cater for their mental health, their social welfare. That includes palliative care and hospice, connecting patients to those services that takes care of the social aspect of, their care. Then this all forms a holistic approach which improves patient outcomes. In the company I work in, we currently have 14 clinical associates, employed as care coordinators, and we have 3 of them employed as coaches, and then we have one that is a national program manager. So I won't dwell much in the coach because that's not the position I'm in, but just to explain that the coach is responsible for team management, training, and performance monitoring. And then as a care coordinator, that's where I come in now and explaining, the role of myself as a clinical associate. So care coordinators, some of the duties I'm responsible for is collection of patient data to formulate appropriate care plans and engaging and building rapport with patients and their families, linking patients to the multidisciplinary team, the appropriate people to, for the proactive care and optimizing their outcomes, whether they're clinical or social care. And then on a day-to-day, doing patient education, compliance counseling, facilitating referrals, and following up patient care, of maybe previous referrals. So that's basically the role I'm playing as a co-coordinator in my current workspace. Challenges I've experienced. So these are challenges that I can say I've experienced throughout, my professional career, not necessarily in the company I'm currently working in. So in my previous employments, I, when seeing that maybe the opportunities, I need to look for more opportunities or for growth or for, because maybe the contract is ending or for other reasons. But when exploring, for potential job opportunities, that's when I found, like you can see the previous speaker, I found myself as a clinical associate that no, we are adequately trained. I mean, they train us very well in universities, but when you look at other roles that you are potentially, pursuing, then I realized that I lacked the diversity. That is what then led to, all the certificates you are hearing that busy mentioning. It's because then identify that, okay, I don't have the diverse skills because clinical associate have that potential. So that's when then I, overcame that by doing continuous training and investing in my education. Investing in your education is, making sure that part of the budget is to use put money aside to do something for education. And then career progression, as we know, some of us may not be, exposed to many environments that, give us an idea that where I want to go or what I aspire to be. I mean, the speaker that introduced us already did say she wants to, be in emergency medicine, but some of us find it difficult, to know where you want to go. So when I realized that okay, now I don't think I have direction or maybe I feel stuck, then that's when I went out to seek a mentor, and I was lucky enough to be mentored by Stephen Matsuku, who helped me a lot in, uh, paving the path. Yeah. Now the vision is clear. And then on job insecurity, as we know, there's sometimes lack of opportunities, for clinical associates or myself. I've since realized that if I'm in one position and I needed to, for some reason, whether for growth or for termination of contract, I needed to, go to another job. I didn't have enough people to advocate for me. I didn't have enough people that I can ask that, okay, now I don't have a job. Can you please help with so and so? So that's when I sought to say, okay, now I have the VMMC training. Let me on weekends during my free time and go volunteer at this, circumcision company. And then that's when I got to prove myself that, okay, they saw that I have the skill, I'm excellent in the skill, and have the professionalism. These are people that then said, okay, now we see that, you have the skill, and then we can work with you. It was a possibility then, which it never happened, but it was a possibility that they said, okay, if I were opening a new site, then we definitely are considering you. So that helped me in networking because even if those people never employed me, they are able to advocate for me to other people. So that sort of networking, forming the network there and there. And then another form of job insecurity is working, whether for a practice or a company without, a contract, then you might face the unfortunate events where, they terminate the contract. I've actually experienced it personally that they come in the morning and they say, no, no, we can't work with you anymore. We're closing their business and everything. And then that's when I'm like, okay, if you are working whether for a company or for a GP practice or for anyone, you need to make sure that there's always a contract that is going to allow you to know at least that, the job security is there at least. Personal achievement in my workspaces. So also these ones span throughout, my after graduation. It's not focused on where I am now. So team leadership is one of them. Skills development, training and development, project success, and currently I'm contributing to my team that I'm currently working in, and the team did achieve a recognition by WHO as an exemplary model of how value-based healthcare can be implemented. As we mentioned earlier, that the company focuses on value-based healthcare, and also they were successful in demonstrating, a 29% reduction in hospitalization in a pilot program for the biggest closed medical scheme in South Africa, which led to a national contract. And one of the other achievements is that the team was nominated as one of the top 14 nominees for the International Value-Based Healthcare Prize. So that's the achievements that I pride myself in as being part of the Value Care team. So these are just, the picture of the achievements in the current team I'm in. So in conclusion, I would like to, say that as a clinical associate, you are adequately trained, to be at the center of the change in healthcare that is being brought by the value-based care model, but not only the value-based care model, but, other spaces. We know that there's more and more organizations like PPSF that are finding value and intentionally choosing to employ clinical associates. So it's up to us as clinical associates to lift the banner high, in those respective workspaces and take up the space. Thank you.
Thank you so much, Thabiso. Up next, we have Ayanda Vika. Ayanda Vika is a clinical associate. She graduated from the University of Witwatersrand in 2020. She also completed a postgraduate diploma in HIV and AIDS management from Stellenbosch University. Ayanda is currently completing her Master of Philosophy degree in HIV at Stellenbosch University. She has worked for the Department of Health in private practice and for Wits Health Consortium. Please may we welcome Ayanda onto this floor.
So thank you for the introduction. It's Ayabonga Vika. I am a clinical associate that graduated from the University of the Witwatersrand. So this is where my career started. So I was on 7 York Road. I enrolled into the Bachelor of Clinical Medical Practice degree in 2018. I'll be honest, I didn't know much about this degree. I just read that it was medical, and I knew I wanted to wear a stethoscope. That's all I knew. And I thereafter enrolled into the degree. And then in 2020, that's when I obtained my degree. But as you'll know, in 2020, that's when we also started having COVID. So what's unique about me is that I was part of the first group of clinical associates that did a bit of online learning. But thankfully, after the COVID restrictions were removed, we went back into the clinical space, but attended most of our classes online. I thereafter was employed by the Department of Health, where I worked at Kopanong Hospital on a COVID-19 contract as a clinical associate. So for the Department of Health, I worked in the emergency department as well as the COVID tent. And as a clinical associate working in this hospital, I was also expected to rotate when needed in the other divisions in the hospital. So I'd also go to internal medicine, to gynecology, as well as in the theater to assist in Caesars as well as in tubal ligation. And for people that aren't too sure where to start working, I'd say the Department of Health is a good start. What I liked about them is that it's very broad. Like I said, you're able to rotate through the different parts of medicine and you're able to find yourself and to decide what you like and what you don't like. So if you're still not sure what you want to specialize in, or if you want to go into research, into academia, I'd say it's a good start to start with the Department of Health. Find yourself, decide if you enjoy emergency medicine, if you'd like to move into obstetrics, or if you'd like to be in HIV like myself. And I'll tell you a bit more about that as we continue with this presentation. So after working for the Department of Health, like I said, that was a 6-month contract, I transitioned to the GP private practice space. So this is where I started working for QuadCare Medical Centers, and this was in Braamfontein, very close to where I was studying, which is Wits University. So it was nice to see some people that I'd seen on campus initially and to have them as my patients now. And my basic duties here were medical consultations, minor procedures, as well as the procurement of clinical supplies. So it was also practice management. And what I enjoyed about working in the space is that it was a lot of freedom. This is also where I learned how to properly write prescriptions, how to decide how to manage patients. So I'd know for patients that I see, I prefer to see them using amoxicillin and prednisone and what have you not? So I basically got to find myself in medicine and to see what works for me and what doesn't work for me. What I also enjoyed about working at QuadCare is that this is where I learned how to do ultrasounds. So that was something also very exciting. And yeah, that's basically what I did in the GP private practice space. This was also very short-lived. I worked for QuadCare for 10 months. And while working at QuadCare, I enrolled for a postgraduate diploma in HIV and AIDS management through Stellenbosch University. So I did this full-time while working at QuadCare. And I'd say this is the degree that changed my career path and my trajectory. As soon as I enrolled into this degree, I knew that I didn't want to be in the clinical space anymore. I want to be in management and I want to be in research. It really set the tone for me. So as much as it's an HIV and AIDS management course, it isn't a clinical degree. It is a management degree. So a lot of the modules that I did were in monitoring and evaluation, strategic human resource management, but I also did have a course in epidemiology. Obviously, you can't be leading public health programs in HIV if you don't have a bit of basics on the actual course. I thereafter transitioned to Wits Vida. So this was after QuadCare, but while still completing that postgraduate diploma, I moved to Wits Vida. So this is the Vaccines and Infectious Disease Analytics of the University of the Witwatersrand. And I was employed here as a clinical associate in data. So I was working on the maternal neonatal health project. So this is MNH. So this is data that was collected before COVID, a bit during COVID. And what happened, or what we had to do, was to abstract all of that clinical information from those hospital records as well as from laboratory results, and to move that to a database called REDCap. And one of the most important certificates that I needed to work in research, so this is health research, was a certificate in good clinical practice. So for those people that really want to transition to research, this is your start. GCP is the bread and butter of working in research in the health space. So I'd really suggest that you look into getting that certification. And then again, at Wits Vida, that was a contract. I thereafter transitioned to the perinatal HIV research unit, which is where I'm currently stationed at the moment. So I'm currently working as a clinical associate, but my main role is to be a study coordinator. So I'm not working in my clinical associate capacity. So my main duty is to assist the project head by coordinating the procedures and daily activities within the study. I'm also responsible for quality control, administration, training, coordination, staff management, patient consultations, as well as phlebotomy. So this is more of a senior role and it's in management. Although I do consultations and phlebotomy, my main role is within administration, coordination, and management. And the exciting part about working in this particular role is that I get to travel, which is something really exciting, which I wasn't able to do in all the other previous roles that I did. And I was fortunate in June to travel to Washington, D.C. for an HIV meeting. And I think this current role where I'm working at the moment is where I could see the culmination of my different degrees and the experience that I have come together. So it now made sense why I'd done that postgraduate diploma in HIV management and that prior experience from Wits Vida. It was all just coming together and it's tied up. So I'm currently at PHRU, or the Perinatal HIV Research Unit, and really enjoying this role. I hope I'll stay there and make a change. Also, I do want to add that I am one of 2 clinical associates working at Perinatal HIV Research Unit. So in terms of that unit of Wits Health Consortium, they aren't as exposed to clinical associate, but I have a colleague that had presented on these webinars, Tswagai, not so long ago, who went into this and spoke about her experiences of working as a clinical associate for the organization. So while working at the Perinatal HIV Research Unit, I also enrolled for my Master of Philosophy in HIV and AIDS Management degree. I really enjoy studying. And this was also at Stellenbosch University. So as you'll see on the screen, actually, I'm also doing a bit of recruitment. Ms. Avuye, please don't shoot me for this one. But I am doing my master's, so I've done my coursework, and I'm currently working on a research project at the moment. And I'm looking at assessing healthcare worker knowledge of vertical transmission prevention guidelines in South Africa. So as you'll know, there's been an update to our HIV guidelines in South Africa, and I want to see how our healthcare workers are doing in terms of knowledge and practice. For those of you that are healthcare workers and have 5 to 10 minutes to spare, please do scan the QR code on the screen, and I'd really appreciate your responses. But now going back to this presentation, the master's degree is a very demanding degree. I don't want to lie. There've been a lot of times where I've sat and I've questioned if it was worth it. And I asked myself, what was the actual reason for enrolling into this degree? Is it worth it? And even though I haven't completed it, I would say it has opened a lot of doors for me. As you'll see, I'm working in a senior role, and this is within 3 years of graduation. I don't think that's something I would have been able to achieve had I just sat with my undergraduate degree and not gone out there and did those extra certificates as well. So for people who are unsure of if they should do a postgraduate degree, I'd really suggest it. But I think you just need to do research of which space you're trying to go into. So if you know that you're interested in emergency medicine, obviously then I'd suggest looking at the honors in emergency medicine from Wits and then transitioning to your MPhil. But obviously our journeys are not alike, and you need to do research and you need to see what will work for you. And then this is a short slide on the certificates that I've done, and I'm just going to touch on the different certificates. So this is to the students and actually everyone working in the health field, or doesn't even have to be the health field. It is so important to do certificates and to upskill yourself when you feel like you've got extra time. And these certificates can be linked to where you're trying to move to, or can be related to the job that you're doing at that point. So I've got a certificate in GCP, Good Clinical Practice, and that's because I'm working in clinical trials. And this is the bread and butter of clinical trials, like I said. So if you're a person that knows that you want to transition to clinical trials, obviously I'd say start here, do the certificate. It should take you 2 to 3 days at most. Another certificate I did, which is needed in clinical trials, is the HSP certification. So I did your Human Subjects Protection Certificate, and this was through NIAID and DAIDS, another important certificate which I need for my current role. And then another one I did was the Gender Affirming Healthcare, and this was through Gender Dynamics. So while working at QuadCare Medical Centers, I worked with a lot of patients that were transitioning and patients that were homosexual. So some would want to go on hormonal therapy. Obviously, this is something new. It's not something that's conventionally taught in medical school, and we're giving testosterone as well as estrogen. So I thought it would be interesting to actually take that course and see what more I can learn, what extra I can learn. So side effects and what to expect from those type of patients when you put them on that type of medication. And then I also did a certificate in the basic HIV course for healthcare professionals, and this was through the Department of Health. And with these certificates that I've been speaking about, I just want to highlight that they were actually all free. The only one that I had to pay for was that first one, which is the Good Clinical Practice, but my employer paid for that. And during the COVID time as well, I did a certificate from FPD in the comprehensive care of the COVID-19 patient. Also did a certificate in clinical quality management plan. So that's the CQMP, and that was through NIAIDS as well as the ABC of quality control. And this was through Academic Advance. So this was also a paid for course, but this was through my employer. So I think it's really important to do certificates in line with the roles that you're applying for or where you envision yourself to be. It's really important, especially if you've got free time. And then this is just a short slide into research and clinical trials. So this maybe for those people that are interested in transitioning to the clinical trial space. And I just wanted to give you a bit of advice on what I see has worked for me into breaking into the space. I noticed that having a postgraduate qualification puts you a bit ahead, as well as having a certificate in that research space that you'd like to work in. So if you'd like to go into oncology, trials or HIV trials or cardiology or tuberculosis trials, I'd suggest maybe having a short 3 to 5 day certificate in that field so that the person that is doing the employment process can see that you're interested in that space and that you're actually trying to be in that space. Another important certificate to have is the good clinical practice. Like I said, this is the bread and butter. And I've just put logos of the different clinical research organizations that one can start looking into and sending their CVs to if you want to work in the clinical trial space. So that's WITS Health Consortium, which is my current employer. There's ICON, PPD, as well as IQVIA. And then my presentation has come to the end, and I just wanted to give you my final thoughts or my motivations. And what I wanted to say is that no two journeys are similar. So what has worked for me might not necessarily work for you, and vice versa. And that I just think we need to keep pushing, especially for the final years. So you're almost done, you're almost there. I know it feels like it's tiring, the late nights, the calls, but trust me, if you can get to your third year, it's almost over. But what I just wanted to highlight is that no two journeys are similar. And I remember when I enrolled into this course, a lot of people told me that there's no job security in this course. You're going to hate it. You're going to be working in the hospital for X amount of hours. And like I said, no two journeys are alike. In my working as a clinical associate, I've actually only had to manage patients in the hospital for 6 months, and I've spent most of my time after that in the office space or in the research space, and that's what has worked for me, and that's what I've enjoyed. And thank you so much. I hope you were able to take something from this presentation, and I hope you enjoyed it. Thank you.
Thank you so much for the presentation. So considering time, I think we can take about 2 or 3 questions.
This is Zuki. I'm the coordinator for the University of Pretoria Clinical Associate Program. And I actually don't have a question, but I just wanted to say well done to the speakers and to their presentations. I was absolutely in awe. Congratulations to all 3 of you.
Thank you so much. We have a question also from Mr. Fiwe. It's, what is the recipe for resilience? What can you share with the students as a recipe for resilience?
Okay, so what my mentor told me before that is that you need to be angry. You'll just choose for yourself, what are you angry at? Are you angry at poverty? Are you angry at lack of knowledge? Are you angry for the lack of progress? You know, are you angry for being in one place? Are you angry that, you know, whatever it is, that you just need to be angry enough? Then that will push you forward. If you are angry enough, then it takes, you know, whatever comes your way, you will, you know, it won't stop you. You become unstoppable because you know that I want to get there, I want to achieve that, I want to do that. So the anger I have will, you know, push me forward. I won't stop for anything.
I think I'd just like to add a small response as well. I definitely agree with that. You need to be angry, but I have a different way of phrasing that. I say, "Ufanele usebenzise inkani." So that means just being, you need to fight for your dream. You need to fight for what's yours, and you need to fight for what you think you deserve. No one's going to think you deserve it, and you need to fight. Yilwa.
Yeah, if I can add, I 110% agree. It's hard out there, believe me. If you're sitting on a 3-legged chair for a year and you're in the back of a boot of an Avanza going to a clinical site to get your research done, those are the things that you're going to face. You're going to face a lot of difficulties, but always know you're the author in your own story. And if you continue to just keep at it and just show everyone what you're made of, you're going to be unstoppable. Everything comes to an end, or anything that bad has happened to you, it actually has just made you stronger and makes the fire burn even more within you. So that's what I could just add to that.
Thank you so much for the motivation. I do believe that everyone that was here, especially the undergraduates like me who are about a bit uncertain about what the future has in store for us, we probably did get a sense of hope and also motivation to just keep holding on in these last few months, especially when you don't even know where you want to be or how you'll get there. But hearing from your stories, the resilience, the perseverance, and just never having the thought of giving up is just a lot for us to take today so that we can be able to continue with the rest of the year. In closing, I'd like to thank everyone that has joined. All the guests that have joined. I just saw on the chat space, there's someone that said she's all the way from UK. So it shows that these sessions are important and they are helping us as clinical associates and clinical associate students. So also please do make sure when you can tell people about these webinars so that they may be able to get all the information that they need. Thank you very much to everyone once again. Thank you to our 3 speakers. Thank you to the division for this. And thank you again to our guests. Have a good night.